All right, welcome back to Daybreak. It's now 12 minutes to 7 o'clock. It's time to speak to Dr. Evans Kimuri, who is the Chief Executive Officer of the Kenyatta National Hospital. And Dr. good morning. We're reporting 2,021 cases now, of course, of the coronavirus disease. We're looking at the month of May, which has been the worst in this country. We're reporting 1,566. The last time we spoke to you, you were very positive. Are you still positive? Well, not COVID-19 positive, but you are very positive in terms of attitude. Do you still feel the same?
Good morning, viewers, and thank you, my brother. One thing I will tell you, I'm still positive because one thing you are saying it is the worst month. I don't think it's the worst month. All what we did is that now we scaled up the testing. And if you remember the first time earlier we had said when we had done the projection or the statistical hypothesis of projecting the trends of a pandemic, we had even said that we'll be hitting the 10,000 and such things if we did not put the measures. But one thing, what has happened, when we were telling you we have reported 10, 15, we used to test 500, but you can see now we are testing close to 4,000 a day. That can tell you that literally the numbers have really not exaggerated, increased. And then, of course, on top of that, we have gone to the community testing. We are doing mass testing, targeted testing, which I can still tell you the measures that the government has put in place, and the trend is still within the expected limits. We are still within safe margins. But that does not mean that we didn't the effort.
Okay. But Dr. even though you said that, yes, more testing is giving us more results, it also means that the infections are growing. Is this something that we need to do that you're not doing to ensure that one day we can have a sample of 3,000 and report very minimal cases?
Normally what happens, and this is a natural trend, it's not a Kenyan trend, it's not a China trend. All pandemic, epidemics will always follow a certain trend. And the trend we try to chase is to a point where we go until we get a flat curve. Right. Before you get that curve, it is normally a natural process. The only thing that happens, if you don't do the measures that right now we have put, I can tell you, my brother, the numbers now would be enormous. But you see what we have put, what the Minister of Health has put, and what you have been seeing Senator Minister Mutahi Kagwe putting in place is that if we did not do that, now we'll be giving another story. Okay. But what we are seeing now is actually within the expected limits. We are not above the curve.
All right, and Dr. when you look at the numbers released by the Ministry of Health, looking at the statistics as of 31st of May, at that time there were 1,962 infections. Those that had been hospitalized were 779. Those that had recovered were 478. The deaths then were 64. But there's a number that is yet to be accounted for. We are told that there are those that have been isolated at home, but there are those that have given wrong contacts. What is the threat of these wrong contacts, and what efforts is the committee putting in place to ensure that they capture everyone that has been tested positive and taken care of?
One thing I will tell you, and at this point I even thank the internal security, we have been working there is a very tight surveillance system which has been coordinating between the Minister of Health, Minister of Interior, that is even the police, NSIS, all those teams have been used, and even sometimes even the Safaricom team, they have been used actually to track down, and we are making sure that all the positive people, we know where they are and they are actually being taken care of. We are not leaving anything to chance, my brother.
Yes, but the Minister of Health admitted that 140 contacts could not be reached. So what is the threat here, and what are the options for the government to nab them?
Well, they are being looked for. Like now you had the Waziri saying one of the patients actually broke the padlock and aggressively threatened everybody, even with a knife, and then he disappeared. Right. But I can tell you for a fact he's back to our custody because he was traced up to where he went. That's what we are trying to tell you. Okay. We are trying to for everybody where they are.
The Ministry of Health indicated, as we wind up, indicated that 130 people had been isolated at home because of their age. How is the care for these people being taken?
These people who are being isolated at home, we have also put a team which is actually checking on them, because sometimes, as you know, the COVID is not friendly to especially people who have vast age, people who have other comorbidities, people whose immunity is compromised. We would not want actually them to be mixed with other people. However, the ministry is making sure that there is a team that is actually taking care of them, even at home.
Okay, all right. Thank you so much, Dr. Evans Kimuri. I wish we had more time because we have so many other questions that we'd want to ask, but that's our time. Thank you for joining us. Of course, Dr. Evans Kimuri is the Chief Executive Officer of the Kenyatta National Hospital. This is was speaking to us on a morning that 2,021 persons have been confirmed to be positive of the coronavirus disease. Many of them have recovered, and now the active cases are about 1,420. We'll be waiting to hear from the Ministry of Health on the latest updates today, based on the people that will have tested positive, as well as the tests that will have been taken so far. So thank you so much for watching the show since 6 o'clock. And thank you so much for your feedback. And that's our time. My name is Sam Gituku, but Zinzi Kibiku will be back at 9 o'clock to bring you the latest in the world of news.